Good morning, everyone. This is Dr. Taylor on Thursday, March 26th. And thank you for joining me for our daily highlights during COVID-19. I hope everyone is surviving with the physical constraints around social distancing and not going to work. These are tough and challenging times. I think we'll all learn a lot about each other, about our families, our spouses, and how we manage during times of change. So I don't want to talk about statistics today, but I do want to talk about what we can do. And specifically, I'd like to talk with you about the usefulness of wearing a mask. There's a lot of controversy and confusion. Actually, masks are now becoming a little bit of a fashion statement. I've seen some very colorful and outfit matching cloth masks being worn. But what should we be doing and why? So in the United States, if you listen to the media, you'll hear that unless you're sick, you do not need to be wearing a mask out in public. That's confusing because part of that message is based on supply and demand. And again, in the US, we're very fearful about healthcare facilities being overwhelmed by patients without an adequate supply of medical equipment. So the public message about masks runs the risk of being swayed by, to some extent, supply and demand concerns. So let's talk about the biology of the SARS-CoV-2 virus, which results in COVID-19 disease. And let's be led by the biology for this talk anyway. So what's the difference between a mask and an N95 respirator, and when should you wear either of the above? So a mask, which is the surgical mask that we commonly see on TV or in the hospital, is a paper mask that can be cinched down over your nose, has elastic bands that go behind your ears or something that ties behind your head. So those masks primarily are effective at preventing the person wearing the mask from infecting someone else. A surgical mask, which is what that's called, does not protect the person who's wearing it from inhaling small particles, but it does prevent larger droplets that could be exhaled or expelled from the mouth or nose. It prevents those larger droplets that are very moist from going out into the room within 6 feet and landing on someone else. So a surgical mask primarily protects other people from someone who's already ill. So if you were to wear one of those surgical masks while you go to the post office, in terms of excluding any inhaled particles, it's not really going to be that effective. However, interestingly, a surgical mask works to protect the wearer in ways that we don't commonly think about. And that is when you exhale into a mask, for anyone who's wearing one, you know that that air is warm and moist. So those surgical masks actually do protect the wearer to some extent by humidifying the air right immediately beyond the nose and mouth. And as we've been talking about before, humidified air is good for us. It helps maintain the hydration of our airways. And any particles that are drawn into that immediate environment that's warm and moist will glom together and become larger and hopefully trapped by the mucus in your nose and throat and prevented from going deeply into your lungs. So there is some benefit to the surgical masks from that perspective. But again, in the US, people are being advised not to stockpile surgical masks and not to wear them when you're outdoors. So I live in rural Vermont, and I'm not around other people. I see my husband and I see my 7 dogs, and my dogs would bark at me if I wore a mask, so that wouldn't work. But in all seriousness, I'm not around other people, so I do not wear a mask. So what's the difference between protection from a surgical mask and an N95 respirator? So the N95 respirator are those sort of large apparati that make you kind of look like an anteater. They fit fairly snugly around your face and your neck. As a matter of fact, if you're one of those guys who's growing a quarantine beard, if you were to need an N95 mask, it wouldn't fit very well over the beard. So there's a different sort of mask for healthcare workers who insist on having a beard. It's more, it has different types of seals. So if you're growing a beard, don't plan to wear an N95 mask, or sorry, respirator. So those respirators are called N95 because if they fit well, they're supposed to filter out 95% of any particle that's 0.3 microns in diameter or small or larger. So an N95 mask is used to protect the person wearing the mask. It would prevent particles from leaving the wearer's airways, but primarily those are used to protect the person wearing the mask, the respirator. Now there's a third type of airway protection called a surgical N95 respirator. And a surgical N95 respirator protects both the person wearing the respirator, anyone outside of that person, anyone beyond them, and it also has capability to withstand fluid transfer. So, for example, if you're a surgeon operating on somebody who is either very immunocompromised or very contagious, a surgical N95 mask would prevent any blood or body fluid spillage from reaching the surgeon's face. So how can we summarize this? A surgical mask, which is the kind we're seeing commonly on the streets, protect others from somebody wearing the mask who might be sick. That's the stated benefit. So if you are sick, if you have COVID-19 and you don't stay inside, which you should definitely stay inside, but even while you're in your home under self-quarantine, and a caregiver comes in, your wearing a surgical mask will help protect them. For the most part, the only benefit of other people wearing a mask is that it would humidify the air that you breathe. So if you go out into a public place, if you go on the subway, which again, we're not supposed to be doing, wearing a mask would probably provide some benefit. Don't worry about trying to find an N95 mask. If you go into a hospital under necessity, you'll be outfitted and things will be taken care of if that is called for. So I hope that clarifies this whole controversy around masks. And in the meantime, everybody, please take care. Try to be kind to yourselves and to others around you. And we're going to get through this. I feel optimistic. Take care. I'll see you tomorrow. Bye.